My name is Brandon Nelson. I'm a patient transporter for University Health. I've been there since 2018, but I have been a patient transporter since 2006. So I am also a published author and spoken word artist, and this is actually my first ever book called Book of Truths. Released it in 2022, and I'm pretty proud of my work. It gives me opportunity to share some of the thoughts that people don't necessarily let free about themselves, and this just happens to be a few of mine. It talks about dealing with some of the things we deal with as men regarding pride and not crying, heartbreak, recovery, and just trusting the experience again. So anybody that gets a copy of it, I think they would be blessed. There's a particular poem called Men Don't Cry. We have been so fine-tuned to not deal with our emotions, we don't realize the pressures we put on ourselves dealing with that. H3 has shown me how to be comfortable with my emotions, but not to dwell in them. And the more that I get to express, the more that it kind of frees. And if anything, H3 has helped me become a bit more free than I was than the first time I participated in the wellness cohort program. So when I presented to Carla and I told her about it, it led to a very eye-opening conversation, which is why I know that she supports it. And I'm grateful for that. Because we deal with a lot of things, being not just men, but also being Black and a world that doesn't always love and always understand. So with everything that H3 has shown me, this book is just merely one tool, I think, that would give somebody else some hope of how to deal with the things that they're dealing with. You can find the book at Barnes & Nobles. You can also find it on Amazon.com, or if you bump into me on social media, you can find me and get a copy yourself. I sign every copy that I deliver because I wanted to always be appreciated anybody who took time to purchase a copy of my book. You can find it either under Brandon L. Nelson on Amazon, or you can look me up by my stage name, Brandon Amayzn, A-M-A-Y-Z-N Nelson, on social medias. I originally got into the medical field for a check, original. It wasn't until about a month or two into the experience, I started really seeing how serious healthcare was. I had the privilege of taking care of the pastor who baptized me. I got to meet a lot of local celebrities because before they are celebrities, they're human beings. I was privy to a lot of conversations with families that were trying to deal with all the care. And then I think the eye-opener for me was having to wield my own grandmother. And it was really humbling. The more that I stayed in healthcare, the more I got to learn. I got to see a lot. And it made me love and appreciate our frontline workers even more. And here I am some near 20 years later, still at it. There is a story. It lasted about 6 months. First year of being a transporter, there was a patient that came in able-bodied. And gradually over, I'm gonna say a year, I watched her go from walking, talking, just as lively as me, to watching her and progressing as dealing with things like diabetes and different illnesses were taking its effect. So there was amputations where she suddenly wasn't walking the same, to being on crutches, to being in an electric wheelchair, to unfortunately one day getting notified that she had passed away. And the day that she passed away, I had a long talk with her daughter. And she thanked me because she remembered every time that I had the same smile. I never treated her any different. I never treated her as if there was something wrong. I always treated her the same way I wanted to be treated if the situation was me in that position. And I cried, but then I smiled because I was glad to know that even in this, I won't say lowly, but position that might not be as extravagant as a nurse, here I was doing my part and I was being remembered for it. And that was really the aha moment for me that what I do matters. And even since then, I've been able to gain pieces of knowledge so that I can conduct myself better in my position, even if it is just a patient transporter. I at least know how to care for a patient better than I did when I started in 2006. As a patient transporter, my responsibility is getting patients to and from wherever they need to be within a hospital, or even as an outpatient and visitor, getting them in a timely manner to their destinations. So sometimes it means I take them by wheelchair. If what is going on with the patient requires, I push them on the stretchers that they're on. And last but not least, it's not always fun, but I move patients by beds, no matter what kind of bed that they're resting in. Sometimes it's with IV, sometimes it's with oxygen or various other pieces of equipment that help get them well. Originally, it was for a check. I needed a job, but after a couple of months, I found that I love what I did. I enjoyed that. It allowed me to meet people, learn along the way, and keeps me from having to go to the gym, because with all the walking, steps, and moving of weight, you're practically working out for 8 hours a day while also being customer service. One of the biggest hindrances for me is that I'm big-hearted and I attach to people. With working within the confines of a hospital, you constantly will see the same faces often, and you would be foolish to believe that you don't grow some attachment to the people you take care of, that you don't eventually start having conversations with them. You start meeting family and friends. You start learning so much about them, and it hurts because they become part of your life. They become part of your routine. And when they're gone, and I'm not talking in as in they got well, but when they're not here to receive that treatment anymore, then it kind of hangs with you. And that you hope that their experience with you wasn't just profitable, but that it was of good faith, that you did the best that you could with them, that you did everything to the T, that you treated them with all the kindness and care in the world, and that you have no regrets in anything that you've done. I was on an internship with the union SEIU, and my organizer called me and was telling me about this program. And she was always aware of how much I do for the hospital and how much I take on. And she thought that this would be a good idea because I had been stressing. And she believed in the program and submitted my name. And so I came as part of the luncheon celebration for the first rotation that had just completed the wellness cohort program. And I was all in. I loved hearing the care about getting mental wellness back and being able to take care of fellow healthcare workers. And so 5 minutes after talking to Carla, I signed up. It's allowed me to learn a lot about myself that I didn't know. And it's allowed me to find that, yes, while I love being a part of healthcare, it's really more stressful mentally than physically. And we don't realize how much we take home with us. And I have a lot of luggage. And so I got introduced through our union, and Carla made me feel just as at home. And so when I signed up, I didn't know what I was in for, but every session was fun because I found that I had a lot more in common with other healthcare workers than I thought. And so every time that she tells me another cohort program is about to happen, I just try to sign up. When she asks for the ambassadors to come, as long as I have the PTO, I am here because I believe in what she's doing. I believe in what they're doing, and I want to make that be as big as it can be in any way, shape, or form. It has shown me that regardless of which path of faith or the way that I live, it's shown that we are all important, that we all need better care of ourselves, that the same frontline workers cannot do what they're doing if they can't take care of themselves. So back in April 2024, we had the third rotation for the wellness cohort program, and we were doing the wellness circle where we were talking about some of the different things we were dealing with, the different battles. And I was getting a chance to speak among new faces as well as familiar faces. And it was a camaraderie that you'd have thought the way we were talking, we had been around each other for years, like we had been to each other's weddings and funerals, so on and so forth. But it was that brotherhood, sisterhood that I felt in that moment, that I can say anybody that wasn't there that should have been there missed out on a blessing. And it was beautiful to watch people from all these different backgrounds be one spirit in the room. I couldn't make that up. Like, that was life-changing. Before, I would take everything home from work. I would take my bad days, my patients' bad days, my coworkers' bad days. I would take this all home, and it would weigh on me. Some days it would happen where I didn't want to go to work. Even though I know what I'm doing is for the right reason, I wouldn't want to go. I wouldn't want to get out of bed. Since joining the wellness cohort program, I'm excited to go back to work. I enjoy what I'm doing all over again, like the first aha moment I had. It's made me handle situations totally different. I've been able to let go better than I used to, and still have all the care and all the grace that I once had. So I'm thankful that I got to be a part of HQ. I'm grateful for every rotation I get to go to that lets me learn something more. Most of all, I'm happy that someone considered me in the first place to even find out about it. I would say that healthcare workers are still human beings first. We are all learning. We're all trying to get better. The same patience that we are expected to have for the people we're taking care of, it's also needed for healthcare workers. And I think sometimes people misunderstand that, or they take that for granted. No matter how good our benefits are, we put aside all the things that we deal with at home to come take care of other people's problems. And sometimes you get mistreated, talked to like you were less than, and made to feel like you aren't even human. And I think that sometimes there should be some level of grace when healthcare workers are stressed out and trying to hide it, trying to figure out how they're going to pay bills, including whether it's keeping the roof above their heads or sending the kid to college, or even trying to finish school so they can better themselves and better their status. If I could change anything about healthcare, it would be better pay without having to jump through so many hoops for it. With less mistreatment and better pay, more consideration would happen. More people would be willing to come to hospitals and actually get all the healing they need. People will be more eager to come to work and take better care of their jobs. It's all a process, a whole circle that would happen, I believe.